somatic sensations. Last time we discussed about tactile sensation and sensation of position. Tactile and sensation of position we discussed last time. Today first about pain sensation. Pain sensation is protective sensation. Say a noxious stimulus, a painful stimulus is applied to a part of the body. The person gets pain and the part is flexed and withdrawn. So pain is a protective sensation and it prevents the tissue damage. Now moreover, if there is a pain in the viscera, it is a warning for the individual. And the individual consults the doctor for the pain in the viscera. Say, pain of appendicitis, cardiac pain. So this compels the subject, the patient, to consult the doctor. So pain has got a warning value. So protective value and then the warning aspect of the pain sensation. Pain is of two types. First pain or fast pain, and then second pain or slow pain. Second or slow pain. First pain, fast pain is short, sharp, pricking and localized. Short, sharp, pricky and localized pain is first pain. Fast pain, say there is a pinprick, cut with a sharp edge, there is fast pain or first pain. Now the second pain or slow pain is diffuse, burning, intense, throbbing type of pain. Diffuse, burning, intense, throbbing pain, diffuse pain. Right? This is the second pain or slow pain. And keep in mind, slow pain is associated with, is accompanied by tissue damage. So tissue damage when occurs, it gives rise to second pain or the slow pain. Slow pain follows the first pain. It follows the first pain. There is a deep pinprick, first there is first pain, and then it is followed by the second pain, the slow pain. So slow pain is accompanied by tissue damage. So from the periphery, pain impulses are carried by two types of sensory nerve fibers. So two types of sensory nerve fibers carry pain impulses from the periphery to spinal cord. A delta fibers and C fibers. A delta fibers and C fibers. Fast pain impulses are carried by A delta fibers. So A delta fibers carry fast pain impulses, and A delta fibers has a velocity of conduction 5 to 30 meters per second. This is the velocity of conduction along the A delta fibers. Slow pain impulses are carried by C fibers. C capital, C fibers, and the velocity of conduction is 0.5 to 2 meter per second. So slow pain fibers are carried by C fibers having the velocity of conduction 0.5 to 2 meters per second. You know, pain receptors are called nociceptors, and these are free nerve endings without capsule. So pain receptors are nociceptors which are without capsule. These are free nerve endings. Pain impulses are carried by the lateral spinothalamic tract to the brain. So lateral spinothalamic tract, it carries the pain impulses. I mentioned about the noxious stimuli, noxious stimulus, painful stimulus. So noxious stimuli are of different types: mechanical, thermal, chemical. Mechanical, thermal, and chemical. Mechanical noxious stimuli: pinprick, cut with a sharp edge, heavy blow or pressure, and then in the viscera, distension or increased pressure. In the viscera, distension or increased pressure. Then the noxious stimuli may be thermal, extremes of temperature, freezing cold, burning hot. Freezing cold and burning hot, these act as noxious stimuli. So extremes of temperature, freezing cold and burning hot, these act as noxious stimuli. Then the chemical noxious stimuli, these include histamine, bradykinin, serotonin, substance P, insect bites, right? So histamine, bradykinin, serotonin, substance P, and insect bites, these act as the chemical noxious stimuli. Keep in mind that all tissues of the body are not having pain receptors. All tissues or organs of the body are not having pain receptors. In the brain, no pain receptor. Where are the pain receptors present? In the meninges. So meninges contain the pain receptors, not the brain tissue. In the compact bone, no pain receptor. Pain receptors are in the periosteum. Pain receptors are in the periosteum, not in the compact bone. Pain receptors are not present in the lungs. In the lung tissue, no pain receptors. Pain receptors are in the pleural membrane. So in the pleural membrane, pain receptors are present. Similarly, in the intestine, pain receptors are present in the peritoneum. In the peritoneum, there are pain receptors. In the liver and spleen, no pain receptors. Pain receptors are present in their capsule. So capsule of the liver and spleen, these contain the pain receptors. Right? Similarly, in the skeletal muscle, no pain receptors. Skeletal muscle contain pain receptors in the connective tissue covering. You know, the endomysium, perimysium, right? So in these covering tissue covering in the skeletal muscle, pain receptors are present, not in the skeletal muscle itself. Pain receptors are almost non-adapting, very slow and incomplete adapting are the pain receptors. And this is the important physiologically, that pain receptors don't adapt much. So that the warning value of the pain sensation, it persists. So that the warning value of the pain sensation, it persists. Pain sensation has two aspects. There are two aspects of the pain sensation: perception of pain, pain perception, and the second aspect is reaction to pain. Reaction to pain or emotional aspect of the pain. So reaction to pain or emotional aspect of the pain. Reaction to pain, it varies in individuals. Reaction to pain, it varies in individuals. Reaction to pain includes vocalization, voice making, and this real pain, I'm here. So voice making, vocalization, clenching of hands, contraction of facial muscles, narrowing of palpebral fissure, flushing or skin pallor, blood pressure changes, movement of the body. The patient is having severe pain, he will toss on the bed. So movement of the body also accompanies pain. Pain may be superficial and deep. Superficial pain is more localized. Deep or visceral pain is not much localized. Visceral pain is felt in the part of the viscera or in the part of the body where viscera is present, but it is also referred, it radiates to distant part of the body. So visceral pain is localized, it is felt in the part where viscera is present. It is also referred, it radiates to distant structures. And this is called referred pain. Cardiac pain is felt behind the sternum and it radiates to the left shoulder, left arm, may radiate to even to the right shoulder, right arm, or neck. This is a typical example of the referred pain. Cardiac pain is felt behind the sternum and then referred, it radiates to the left shoulder, left arm, even right arm, right shoulder, or even neck. Similarly, other visceral pains are also referred. So what is the basis of the referred pain? Basis of the referred pain. It is dermatomal rule. So it is dermatomal rule. dermatomal rule, that is the viscera where pain originates. The viscera where pain originates and the part of the body where pain radiates are supplied by sentinel fibers from the same segment of the spinal cord. So the viscera where pain originates and part of the body where pain radiates, both are supplied by sentinel fibers from the same segment of the spinal cord. So same segment of spinal cord, it supplies the viscera where pain originates and the part of the body to which pain radiates. So this is the dermatomal rule, the basis of the referred pain. Pain sensitivity, it varies. It varies in different individuals. Some may be less sensitive to pain, some may be more sensitive to pain. How can you test pain sensitivity? How can you test pain sensitivity? There are different methods, simple methods. The first one is pinprick with measured pressure. Pinprick with measured pressure. You have seen the pricker. With measured pressure, you test the pain sensitivity. And then other method is application of temperature, measured temperature. Application of measured temperature to the skin. But generally, pain is felt when skin temperature is above 45 degrees centigrade. Generally, pain is felt when skin temperature is above 45 degrees centigrade. And keep in mind, above 45 degrees centigrade, tissue damage starts. So above 45 degrees centigrade, tissue damage starts. The other method to test pain sensitivity is pinching the skin. So by pinching the skin, pain sensitivity can be tested. I told you that superficial pain, fast pain is localized. Deep pain, visceral pain is not much localized. Now in the localization of pain, there is a role of touch receptors. In pain localization, there is role of touch receptors. Right? So this was about the pain sensation. Next, I discuss about thermal sensation. Thermal sensation. Thermal sensation. Human beings can perceive 5 grades of thermal sensation. So human beings can perceive 5 grades of thermal sensation. From one end, freezing cold, cold, cool. Then there is indifferent zone, then warm, hot, and burning hot. So human being can perceive these grades, not 5, these grades, there's 6 grades or 7 grades of thermal sensation. From one end, freezing cold, cool, indifferent zone, warm, hot, and burning hot. So these are about 7 grades, not 5, 7 grades of the thermal sensation, freezing cold, cold, cool, in different zone, warm, hot, and burning hot, and burning hot. There are two types of thermal receptors. Two types of thermal receptors, warmth and cold. Warmth and cold. These thermal receptors are present just beneath the skin. Just under the skin, these thermal receptors are present. At the extremes of temperature, say freezing cold and burning hot, there is also stimulation of pain receptors. You see, pain receptors. So at the extremes of temperature, say freezing cold and burning hot, there is stimulation of pain receptors. Right? So in the perception of freezing cold and perception of burning hot, the stimulation of the cold or warmth receptors. In addition, pain receptors are also stimulated. Just under the skin, I told you thermal receptors are present, warmth receptors and cold receptors. But these thermal receptors are in aggregations, spots, aggregations or spots. So there are warm spots and there are cold spots. Warm spots and cold spots. Cold spots are 4 to 10 times greater than the warm spots. So cold spots are 4 to 10 times greater than the warm spots. From the cold spots, or from the cold receptors, impulses are carried by mainly A delta fibers, some by the C fibers. So from the cold receptors, impulses are carried mainly by A delta fibers, and some impulses from the cold are also carried by C fibers. From warmth receptors, impulses are carried by mainly C fibers. From the warmth receptors, impulses are carried mainly by the C fibers. So you see this curve. This is one extreme, freezing cold. And when temperature falls with 10 to 15 degrees centigrade, you see pain receptors are stimulated. And this is the response from the cold receptors. So maximum is a temperature of 25 degrees centigrade. So response from the cold receptor is maximum at temperature of 25 degrees centigrade. And you see that at 30 degrees centigrade, response from the warmth receptors starts. This is from the warm receptors, the response starts. Warm receptors, this response. And you see at 45 degrees centigrade, response from the pain receptors start. You see. So at 45 degrees centigrade, response from the pain receptors start, and this gives rise to sensation of the burning hot sensation. Now you see freezing cold, cool, indifferent zone, warm, hot, and burning hot. Now in the indifferent zone, it is between 29 degrees centigrade to 36. 29 to 36 degrees centigrade. This is the indifferent zone, neutral zone. It means in this zone there is no feeling of warm or hot. So no feeling of warm and hot in this zone. In this zone, no feeling of the warm and the cold. Warm and cold in this zone, that is the indifferent zone, no feeling of warm or cold. Exposed parts of the body, say hands, face, these are less sensitive to temperature changes than the covered parts of the body, say upper arms, trunk, right? So exposed parts of the body are less sensitive to temperature changes than the covered parts. The exposed parts may respond to change of temperature of say 0.2 degree, 0.5 to 1 degree centigrade, the exposed parts. And the covered parts may respond to temperature change of 0.2 degrees centigrade. So exposed parts, say hand, face, can detect change of temperature of 0.5 to 1 degree centigrade, while the covered parts are more sensitive. These can detect temperature of change of 0.2 degree centigrade. Now, have you ever thought that we can take hot drinks with a very high temperature, which cannot be tolerated by fingertips? You can take hot coffee, hot tea, milk, and a very high temperature, which can't be tolerated by the fingertip. And keep in mind, mucosa of the mouth is relatively less sensitive to high temperature. Mucosa of the mouth is relatively less sensitive to high temperature. That is why you can take very hot tea, very hot coffee, which can't be tolerated by the fingertips. Thermoreceptors respond to both steady temperature and changing temperature. Thermoreceptors respond to both steady temperature, that is static temperature, and also changing temperature. This marked response of the thermoreceptors to changing temperature. So marked response of the thermoreceptors to changing temperature. So if you exposed to falling temperature, you feel more cold. If you are exposed to temperature which is increasing, you feel more warm or hot. So marked response of the thermoreceptors to changing temperature. Of course, these respond to steady or static temperature. What is the mechanism of the stimulation of thermoreceptors? Keep in mind that temperature changes results into change in the metabolic rate. And change in the metabolic rate, it results into stimulation of thermoreceptors. So change in temperature will change metabolic rate, and change in the metabolic rate, it results into stimulation of thermal receptors. Right? So keep in mind the grades of temperature which we can perceive starting from the freezing cold, cold, cool, indifferent zone, neutral zone, warm, hot, and burning hot. Right? So this was about the thermal sensation. Before that we discussed the somatic sensation. So with this we complete discussion on the somatic sensation. Somatic sensation. Thank you.